Hello, and welcome back to another episode of Capsule RX Podcast. Today I'll be your host, Dr. Jovin. Thank you all for being patient on this week's episode. Had a lot of different issues going on, but I'm glad to finally get it to y'all today. And today I'm just going to jump right into it. So anybody who was searching for a residency, unable to match phase 1, phase 2, they did the scramble, still weren't able to get a residency, but you really want to be a clinical pharmacist. That is your goal. And you probably had to settle for a different position, maybe retail, maybe something else, but it's not what you truly want. If you are in that situation or someone you know are in that situation, send them this episode because I'm going to tell you how to get out of it. The easiest way or the fastest way to get out of it, what I would do if I was in your shoes, I would look for the largest hospital system within my area. Now, that hospital may not be close to me. I might have to drive far, but I would search for the closest large hospital system because I know that they would have multiple branches of that hospital, multiple facilities. And because of that, they might have something called a float pool, or they might have something where you can pick up shifts at all these different institutions. And I would use that as my key to get that clinical position. Why? Because what's going to happen is there's going to be different pharmacists that are working at these places. And every year you might have some pharmacists retire, or pharmacists have to move or leave their career, different things going on, right? But if you bust your butt, you work as hard as you can at these different sites, at these different facilities, the bosses will take notice, and that will give you the opportunity that you've been wanting or you've been desiring to possibly get added on to that hospital. So you bust your butt. You're working as hard as you can. Most likely you'll start off staffing, doing a lot of central pharmacy things, and you're going to be focused on that. You're going to do the best that you can, and then maybe they say, hey, we have an opening. Are you interested in taking this position? That's when you say yes, and then you stay there, and then you keep working, and you just express your interest in getting to a clinical position. And then trust me, eventually they would either train you or it'll just work out to where you will get worked into that role. And that would be my advice to you if you are unable to get that clinical position, you're unable to get that residency that you so desire to help you get that clinical position, just do it the old school way. All right. The residency to me is the quick path to getting the clinical position. But even if you were to do a residency, you're going to have to work super hard during that whole year. Like I did it. All my friends did it. Like it's a tough year. It's a very challenging year. So why not still keep that same mentality, have a tough, challenging year? Because if you wanted to do a residency, you're going to have to put in a lot of work. So don't be lazy. Try to go to these large hospital systems that have a whole bunch of different facilities and work your butt off there. It's the same mentality, except you're doing it at multiple different campuses or at multiple different facilities, and they will definitely take notice when that opportunity comes. That's when they'll come knocking on your door, and then you can go ahead and get into a position. And that's happened to multiple friends of mine, and sometimes it even works out better for them that way because then they're able to get pharmacist pay for that year, and then when something opens up, something can open up in whatever they desire, and now you didn't have to take that pay cut. You didn't have to go through the rigorous hours of a residency, and you were just able to work, go on vacation, travel, hang out with your family, do what you like, and then go straight into the job that you wanted after about a year of just working hard. That's what I would do. That's exactly what I would do. So if you have any questions or need some advice, you feel kind of stuck in the position you're in, please feel free to reach out to me. You can just message me on Instagram at @new_CapsuleRX podcast, or also on YouTube and TikTok, same name, at @new_CapsuleRX podcast. And anybody that still needs help with the Naplex or MPJE, please feel free to reach out to us, tinyurl.com/CapsuleRx services. And that's it. Quick, brief, straight to the point today. Thank you guys for your patience. merch coming soon. Hoping to release that in July. So if we've helped you at all with the podcast, you've able to connect with somebody, you appreciate the work that we're doing, please buy some merch. Support us. Whenever you're wearing it, you're definitely representing us and helping to spread the word about our brand. So I greatly appreciate it. And I think that's it. I don't think I have anything else to share with you all today. So continue to support Finance Fridays, Test Your Knowledge Thursdays, Teach Back Tuesdays, Self-Care Wednesdays. We're posting. We try to get it to y'all as much as we can. It's the summertime, so everybody's taking trips. Everybody's doing different things. We're all busy. A lot of different things are going on, but we're trying our best to continue with all the content and stay as consistent as possible. So thank you for all the love and support. If there's anything we can do for you, once again, just feel free to reach out to us. We're on YouTube, TikTok, Instagram, at @new_CapsRx podcast. And if you need any help at all with the NAPLEX, MPJE, job interviews, CV review, etc., please feel free to sign up at tinyurl.com/CapsRx services. Thanks, guys.